on Robin Hood Radio. It's nice to welcome back Bill Pond from Noble Horizons. We were just talking before we got on the air, and I said, it's just like a Groundhog Day. Every day we wake up and we go through the same thing. Bill, nice to speak to you again today.
Hello, Marshall. Thank you.
Well, we are now in March, April, May, June, July, almost 6 months, actually, of dealing with the coronavirus. And we feel pretty good here in Connecticut and even now in New York. But we were just, and you had just said it, it is all around us. And as a home for people of elder age, you have to understand that even though it appears things have calmed down here, that they haven't. You have got to be on your top game no matter what, because it's all around us.
Yeah, it's funny that 6 months later we're still talking about this. And you're right. For us, the battle continues. It's taken on a different form. But we had our morning meeting earlier today. That discussion was front and center. Not letting our guard down, being vigilant, and now looking in areas that we were not considering necessarily a few months ago. We've opened up very structured visitation on campus for our nursing home residents, and the visitation now is such that we have people that do have relatives out of state, and it's becoming very much a focus to be sure that people traveling from those states on the restricted list are very well researched, and in some cases we have had to say no, just out of the precaution. We've had a pretty good track record, and we just have to keep it going a little bit longer, it seems.
Well, the abundance of caution is the key word, and I keep saying every day when I sign off on the air, wear the damn mask and do your social distancing, because, the deniers can't deny when you look at the states that do have social distancing and masks when needed in public, and you look at the other states that don't have that, bingo, there's the answer. If there's one way to slow the rate of this, it's just by following those two simple rules, and sooner or later a vaccine will come out and things will get back to semi-normal. But I really don't imagine. I think about people who work in the emergency room in hospitals, and I think of you and the folks that work at Noble Horizons and other healthcare facilities for senior citizens. The things that you now still have to do day after day, and not even let your guard down for a second. It's a tough thing to do for 1 month, 2 months, 3 months, but half a year going on, it's I just give you folks all the credit in the world.
Well, sir, I appreciate that, Marshall, very much. And it has taken its toll. I mean, we have not had the burden, if you will, of having COVID positive patients in our facility. We continue that streak, thankfully. But the toll that we see developing, and again, it's been part of our discussions very recently, is the developing challenges to our staff's morale and our residents as well, because it has continued on for such a long period of time. And it's not that we're fighting the actual cases in-house per se, but now we're fighting the mental battle, if you will, the anxieties that go with trying to keep it away, and also trying to reinforce each other and hold each other up to continue the focus, because we're concerned that should the focus sway, or a mistake happens here or there or outside of us beyond our control, then we're back in a whole different ball game, and we don't want that to happen. So
now do you have ongoing daily tests for staff and for residents?
We started finally testing the staff members last week, and that's part of the state's overall program, and that was introduced here for the first time on Friday. We were tested again on Monday. We will be tested again this coming Friday. The results are still pending. We should have final results from Friday's test today. And if we go a period of a couple of weeks' time, 14 days specifically, with all negatives and no positive cases, then our testing can be relaxed as it pertains to the state and CDC guidelines. But So we've been waiting for that. It's finally started to happen. The testing rate in the state of Connecticut, the positive results are less than 1%, and we're optimistic that our results will be certainly, very positive in the sense that we everybody's going through this testing negatively. We don't have anybody on campus, staff or residents for that matter, with any kind of symptoms at all. So we're confident that we'll be okay with that.
And of course, this is like we just talked about. It's got to be an ongoing policy. You must have you must issue a lot of, I won't call them rules, but declarations, advisories to the staff and residents as well.
Well, we do. And it's maybe nothing more is just reminders of what we're already doing. And you said it a little earlier. No one has all of the answers, certainly, to this whole virus and how it's passed along and how it does this and how it does that. But the common denominator here is really very basic, as you mentioned, the masks and the social distancing. And, we put reminders out to staff, before the weekends or the holidays just to be sensitive to that, because where we have a pretty good idea as to how to carry ourselves, we're not always in company that understands, I think, the insights that we have. So you have to be careful.
Now, what about admissions at this time of what's going on? I mean, you have admissions for people that might need a permanent place to stay. You have admissions for people that might want to do rehab or need rehab. I mean, how hard has this been, and how do you handle it on admissions?
Well, we have finally reopened our admissions back in June, and the state has allowed for new admissions to come into the facilities under certain guidelines. It's a very structured process whereby people coming in from the outside are admitted to a unit where they are isolated for precautionary purposes for a 14-day period. And just as a matter of oversight to ensure that should there be a virus involved, that individual is treated as such appropriately with the proper PPE and the proper isolation protocols in place. We also, though, ensure that the screening takes place before they come in. We are not accepting people that have had the virus or have been tested positively for the virus. They have to have a couple of different negative tests before we agree to take that individual in. And then we follow them for a course of 14 days, and then at that point they can be relocated to a more appropriate unit, if you will, after admission. But it's a bit more structured than it has been in the past. It does limit us to some degree, but it does also lend itself to maintaining the safety standards that we have in place.
All right, and finally, I guess my question to you would be, what you look ahead at. Obviously now you look into the future and you know that living now with the coronavirus is obviously a part of all of our futures for at least the next year and a half, probably.
Yeah, they talk about the vaccine, and I think that's the holy grail at this point. If there's a vaccine that becomes available in our near future, that would be simply wonderful. But there's really no closed. There's no final chapter to this right now. The future is such that it's day by day, week by week. Continue to ensure that we're practicing the safest protocols that we can, and just hope that through the science that's out there, and one of these companies does in fact come up with the final solution. That's kind of the timetable. So we're going to be going through this, I think, with the standard practices that we use for the foreseeable future, certainly into the fall. And I guess part of the surprise is that when you and I started having these conversations back in 3-4 months ago, we were kind of hoping the end would be here by now, and clearly that's not the case. So it really is kind of hard to put a final chapter in this book just yet.
Well, once again, just keep up the good work there. Tell everybody that works there and all the residents there. We think about them and thank them every day, and we think about the residents and their loss of contact with family and friends, and the great job you're doing there. Just pass it along that the community really appreciates what you're doing at Noble.
Marshall, thanks very much for the kind words, and we'll certainly do that.
All right. Stay safe, and I'll speak to you obviously again within the next month or so.
Sounds great. Thank
All right,
you.
take care.
Bye-bye.